Will the Committee of Supply come to order? This section of the Committee of Supply will now resume consideration of the estimates of the Department of Health, Seniors and Long-Term Care. Questioning for this department will proceed in a global manner. The floor is now open for questions. Honourable Member for Roblin.
Thank you very much. I will just jump right back into it. I wanted to start by asking a couple of questions related to the Brandon Minor Injury Clinic that was announced last month. I have two questions. I'll phrase them together. One is, can the minister confirm that new funding has been made available for the operation of this clinic, and where in the budget would we find that funding? And secondly, can the minister confirm exactly what services and equipment will be available at the Brandon Minor Injury Clinic?
The Honourable Minister for Health, Seniors and Long-Term Care.
While we get some more information on that, I want to use this opportunity, since it's been a little while since we've been at this committee, to talk about primary care, because what the member is asking about really is about primary care and the importance of primary care in Manitoba. Access to primary care and enhancing access to primary care has been a big priority for us as a government. It's something that is a huge priority for Manitobans, making sure that they have more access to those who provide primary care and not less has been key. And so I just want to share a little bit of information in terms of what have we done since the last time we were here at this committee to improve Manitobans' access to primary care. And one of the big things that we've done, and we were really, really proud to share this several weeks ago now, is we've added more healthcare workers to the front lines of the healthcare system, including those who directly provide primary care services to Manitobans. 873 net new healthcare workers added to our healthcare system is 87% of our target to add 1,000 net new. Those are really important numbers. There's a breakdown of that I can provide, but at a high level, I want to talk about what that means. It means that more Manitobans have access to doctors, nurse practitioners, nurses, those folks they count on to provide improved access to primary care services, be it in minor injury and illness clinics, be it in clinics of different kinds in community, be it in hospitals, sites across the province. And the first and most important step to achieving anything that our government has laid out in our budget for 24-25 and budgets moving forward is making sure that we have the people on the front lines to deliver that care, which is why that really ambitious target of 1,000 net new healthcare workers And again, that's a very ambitious target. It was one that I think Manitobans saw that target and they raised some eyebrows and questioned whether or not, based on 7.5 years of cuts to healthcare and mistreating healthcare workers and driving people out of the healthcare system in droves, whether or not we could actually achieve that. But what we said at the time when we announced that target was that Manitobans deserve an ambitious government. They deserve ambitious goals. Manitobans have really achieved some pretty ambitious overcome obstacles and achieved ambitious targets themselves, and they deserve to finally have a government that matches their level of commitment to improving healthcare. And so we've made progress, not enough. There's a lot of work to do in making sure that we have more healthcare workers in primary care and across the system, not less. Continue to add net new folks to the front lines, but we're committed to doing that work. We're committed to making sure that we stand up investments that meet the needs of Manitobans across the province, be it in rural Manitoba, in Brandon, in Winnipeg, in the north. We're really working with our partners across the province to make sure that when we make these announcements, they're not just announcements and they're not just commitments. They're things that we can action on behalf of Manitobans to move healthcare in the right direction. And so when our government talks about clinics, when we talk about improved access to primary care, what are we saying? Well, what we're saying is more people on the front lines, more folks to provide the care that Manitobans count on. It's also important that when we look at primary care, that we're talking about more than just physicians. Physicians are awesome. Doctors are great. We love doctors. Our government makes that very, very clear. We're thrilled to work with them to improve healthcare for Manitobans. But we're also talking about experts in the system that, again, were mistreated for 7.5 years by the previous government, kind of ignored. Like nurse practitioners is a good example. When I met with those folks in my office, I was shocked to learn they'd never been to the Ledge. They'd never been invited to the Ledge by a health minister to meet and talk about their expertise and how we can work together to make healthcare better. And I have to say the nurse practitioners we have in Manitoba are absolute rock stars. These are phenomenal people, incredible scope of practice, incredible commitment to making healthcare and primary care better for Manitobans, and really have been wonderful partners in terms of how we work together to really enhance the conversation around what it means to provide primary care. And I would go even further than that to say, having really meaningful conversations with nurse practitioners and other folks about how do we improve access to care beyond primary care while using expertise like NPs, like midwives, like allied healthcare professionals and other folks. It's a really exciting time in Manitoba for healthcare because there's a lot of openness to creativity and innovation. And quite frankly, it's an openness that was there previously, but the previous government just had no interest in engaging these folks, which is really shameful. So thrilled to be in a position where we can do this work alongside our partners and really improve access to primary care by making investments as a government.
The honourable member for Roblin.
Okay, thank you. And so just to restate my original question and add a little bit more request for information, in addition to information about where the money for the clinic is coming from, the services and equipment that are going to be available at the clinic, I would be interested, the minister's talking about staff. What will the staff complement be at the Brandon Minor Injury Clinic, and has that complement been filled?
The Honourable Minister.
Thank you, Chair. I'm just waiting for a couple of additional pieces of information. But, while we have a couple of minutes, I just want to talk a bit more about why this particular step was taken in Brandon in terms of, again, primary care. And I want to go back to our government and the Premier and I, our decision very early on, right in the beginning of forming government and being sworn into cabinet, the decision to go out and send an open letter to healthcare workers and to subsequently let folks know that we would be undertaking a listening tour and sharing with Manitobans and those on the front lines that it was a value of ours, a priority to get to the front lines and hear directly from Manitobans providing direct care to patients and communities each and every day. This is something that I have to say I was shocked that opposition members made all kinds of jokes about going to the front lines and listening to healthcare workers. Folks mocked me for saying, for going out there for an hour or two at a time during peak times when we could access healthcare workers. It was shocking to me and surprising, disappointing that opposition PC members would actually criticize the decision to go to the front lines and listen to healthcare workers. I thought it was a bit strange. But then when I reflected on the previous 7.5 years, I guess it did make sense. It lined up. It was disappointing because it showed that behaviors and ways of thinking hadn't changed for the PC members, but it didn't deter us from doing the work of going to the front lines of healthcare facilities and sites and meeting with healthcare workers right where they're at and hearing what they had to say. And, when we went to Brandon and when we met with folks there, it was really enlightening to hear from those frontline healthcare workers of all demographics. We're talking about nurses, allied healthcare workers, facility support workers, housekeeping staff, environmental workers. There are even some folks who work in community primarily that have relationships to the hospital who actually attended to share their thoughts and their expertise. And it was really, really enlightening to hear directly from these folks in terms of what they wanted to see. Really clear right from the get-go that what they wanted to see was improved access to primary care. And they wanted to see creative ways of addressing the inadequate access to primary care for folks living in Brandon and surrounding areas. And so, by way of sending out that letter saying we respect healthcare workers and we're here to listen, by way of our listening tour stops, including in Brandon, by way of building these relationships with folks in Brandon and surrounding communities, we were able to make the decision to invest in improving access to primary care and finding a creative solve to a real challenge they've been facing in terms of how do we make sure that more Manitobans have access to the services that they need. How do we make sure that if your kid, people always give the hockey example, I'm a little biased, I'll give a basketball example. If your kid is playing basketball and maybe they catch an elbow or something like that and they need some stitches, that they have a place they can go that's not the emergency room to get that care. It's wintertime in Manitoba for about, so many months out of the year. If you slip and fall and you hurt yourself, maybe need casting, where can you go that's not an emergency room to get that care? And that's those questions that Manitobans have been asking, the answer resides with minor injury clinics, after-hours clinics, enhancing access to primary care in a way that reduces pressures in other ways, but really is just about making sure that if your loved one needs a place to go that isn't an ER, someplace that's more appropriate, you can take your kid there. You can take your elderly loved one there. You can go there yourself. I'm already hearing the benefits from folks who have lived experiences accessing these services and how it's really helping them and their families in their time of need. It makes a lot of sense for them to access these doors for primary care. And so, when we talk about why we take these steps, and it is, of course, in the budget, so the resources for this clinic and other investments are outlined in the budget. We are talking about team-based care. So again, physician, nurse practitioner, we're talking about team-based models of care that make the care that people access more comprehensive. And the hope with that is that it better meets people's needs. And the evidence for team-based models of care is well supported and well documented. Some great success stories across Manitoba that we can point to. And that's why we've taken the approach with this particular clinic to make sure that we've incorporated that approach into the model.
Honourable Member for Roblin.
Did the minister's government instruct Prairie Mountain Health to find the funding for the Brandon Minor Injury Clinic from within its existing budget?
The Honourable Minister.
No. But I'd like to actually expand on what I shared earlier in terms of team-based models of care. So there's a number of folks who are employed through that MIC. And again, you know, talking about team-based models of care, and having been a nurse myself working on the front lines, I truly appreciate what team-based models of care allow for you to do as a provider. It's a really, really important approach that empowers all folks on the team to see themselves as participants in providing quality care to folks who are accessing that care. Everybody has a really important role to play in folks having a good quality care experience in the system. It's an opportunity for us to also evolve as we grow. And so when we look at taking creative and innovative approaches and building on successes where we've seen these models work previously, you know, as a government, we want to be able to be nimble and you know, work with Prairie Mountain Health and work with our partners to identify if there are areas that maybe we've missed where we can improve access to care. You know, I shared a few minutes ago about an announcement that we made around hiring a net new 873 healthcare workers. You know, what I'm thrilled, there's actually a lot I can't wait to share here in this space in terms of what we've done since the last time we were at committee in terms of healthcare. But, you know, when you go to a minor injury and illness clinic, there's all hosts of reasons why someone might present there. You know, maybe somebody needs a script for birth control. Well, good news, Manitobans, as of October 1st, birth control is free in this province, which is pretty fantastic. And that is primary care. That is primary health care. And, you know, there are so many different ways in which Manitobans need to access primary care. And we have an incredibly diverse, beautifully diverse province, and it's important that we have team-based models of care that can meet those diverse needs. So again, we've added 873 net new healthcare workers. We've done things like introduce universal free coverage for birth control, which is fantastic, a really important step our government has taken. And all the places that folks can go to benefit from these investments, they include places like the Minor Injury and Illness Clinic. You know, when we look at who's working there, when we look at who staffs a clinic like that, we're talking about nurse practitioners, we're talking about nurses, we're talking about laundry aides, clerks, medical office clinic clerks, we're talking about security personnel, social workers, managers, materials management handlers. We're talking about a very, very dynamic team of folks who are all contributing to the ability of Manitobans in rural Manitoba, Brandon folks being able to access care at this clinic. And again, I can't overstate the importance of having diverse teams, dynamic teams, multidisciplinary teams, folks who get to really work off of one another with each other to make sure that folks are getting the kind of quality care that they deserve. And so, you know, the money was prioritized in our budget for primary care, enhancements to primary care, because our government recognizes the value of that. And we've worked with our partners so that we can work with them collaboratively to identify the best opportunities to get that off the ground, which has been really, really exciting. And I have to commend the leadership at Prairie Mountain Health. Those folks have been really good to work with. You know, folks like Trina, who just have a really deep understanding and appreciation for healthcare, is just doing a great job as a leader, and who are willing to rise to the challenge of addressing 7.5 years of cuts, consolidation, mismanagement, and mistreatment of healthcare workers, to work with our government to move healthcare in a better direction. Now, all of that being said, this kind of work doesn't create the changes in healthcare that we need to see overnight, right? This takes years and years of effort, sustained effort. You know, I sometimes would say it's not a sprint, it's a marathon, but it does feel like we're sprinting a marathon a lot of days in order to do this work, and we'll continue to do that because that's what Manitobans elected us to do. But certainly, you don't fix the kind of damage that was done in a year. I wish we could. It doesn't work that way. It's going to take us years of sustained effort, partnership, and collaboration. and learning from how things evolve after we action these investments to continue to move things in the right direction.
The honourable member for Roblin.
Thank you. I just want to state on the record that I've asked 3 questions now, and the minister has talked for nearly 15 minutes around the answers, but has not actually answered the questions. I'm a fairly reasonable person. I don't expect that the minister would have all of these answers at their fingertips, or even that their staff would. The minister can always take these questions under advisement and get back to me later with the answers. I will try one more time. I'm asking for information about the budget for the Brandon Minor Injury Clinic. How much and where can I find it in the budget? What services and equipment are available at the clinic, and what is the staff complement? The minister talked about the different types of staff that will be in the clinic. I'm looking for numbers. How many staff, and is that complement full?
The honourable minister.
Thank you, Chair. The member's previous question was asked and answered. It was very clear that we have provided the funding in the budget, that not Prairie Mountain Health, but flowed through Prairie Mountain Health, but our government allocated those resources in budget 24-25. The list of the staff that I provided, that's who's working at this site. We've got about 11, just under 12 FTEs. It's 11 FTEs. We've filled 10 of those 11 positions. And, you know, what's really exciting about this clinic, like, you know, all clinics, primary care that we are investing in enhancing in Manitoba across the province, is the ability for Manitobans to go there for a whole host of primary care needs and issues. And, you know, one area of healthcare that we really didn't hear a health minister talk about for many years under the previous government was reproductive health care. We didn't hear a health minister talk about menstruation. We didn't hear a health minister talk about the importance of reproductive health care like prenatal care, Pap testing, really basic abortion healthcare. Like, we're talking basic aspects of healthcare that affect 50% plus of the population. Ask a health minister 5 years ago, they would have said, I don't know. I'm not talking about it. Ask someone else. It was confusing for healthcare providers, primary care providers, clinics to get an answer because the health minister of the day just didn't want to talk about basic human healthcare needs. Really a concerning approach. And so as the minister now, it excites me to be able to talk about the ways in which we're enhancing access to these services that so thousands upon thousands upon thousands of Manitobans count on. You can go to a minor injury and illness clinic and you can get care and treatment for UTIs. You can get access to phlebotomy services. You can get care for suspected fractures. You can get preventative health care needs met, chronic health care needs met. You can go in and, if you're a young person or any person who, let's say, has never had access to, particular reproductive health care needs, maybe you want to have conversations with the provider about, what does going on birth control need to look like for you, or you've had a change in your menstrual cycle that's concerning and you need to get somewhere that's not an ER and have that addressed and have that conversation, guess what? You can go there and have those needs met. You can ask those questions. That's all really important. Fundamentally, it's critical that you have a government that is not going to downplay the value of enhancing access to those kinds of healthcare services and that works with providers to improve access. And so, when I list off all the folks who are employed and who are staffing the minor injury clinic, like I said, nurse practitioner, nurses, aides, clerks, security folks, social workers, managers, materials management handlers, social worker, that's huge, right? We're talking about folks who not only are you going in there to talk about, let's say, your reproductive health care needs, but perhaps you're going in there and you've got questions about, I also want to talk to somebody about what services exist for me to meet my family's needs. Maybe you're looking at some family planning challenges. Maybe you're looking at some resource challenges in the community or you just don't have the information. Guess what? There's somebody there in this team-based model of care that can answer those questions for you. And so on page 82, we've got a list of the investments our government has made to enhance access to provincial healthcare services. And as I stated, it's so important that we not only make these investments, but we talk about what they mean to Manitobans. And after a deficit approach, an approach previously that really just devalued the importance of talking about reproductive health care, women's health care, the health care of gender diverse Manitobans, I'm thrilled to be in a position where we can invest in primary care and also invest in the ways in which all Manitobans access that health care. And we're going to keep learning as we go. We're going to keep making changes. The 11 FTEs now may look different in a year from now or 2 years from now based on what the community says their needs are. And that's an openness that we have as a listening government.
The honourable member for Roblin.
Thank you, Chair. And admittedly, I'm newish to the legislature. I've only been here for a year, but I'm not afraid to talk about abortion or menstruation or birth control or reproductive health care or any of those issues. I'm open to that discussion anytime. I do want to talk about some bed issues. I'm going to ask for some information here. This is a big request for information. Feel free to take it under advisement. The NDP government has made several bed commitments. 31 acute care beds at the Grace in November 2023, 36 acute care beds at St. Boniface in January 2024, 9 new beds in Dauphin also in January 2024, 50 new beds for HSC in April 2024, and the 68 transitional beds that were announced over the summer. I would like to know what the status of these beds is. How many of them are open and operational today?
Honorable Minister.
Thank you, Chair. So part of the reason why our government identified very quickly that we needed to add beds back to the system was because we watched year over year as hundreds of beds were cut from the system. Now, a lot of Manitobans rightly ask the question, man, why does the system have the challenges that it does right now? And we only have to look to the years of cuts and closures of emergency rooms, consolidation of services, during a time when our population was growing, aging, and complexity of disease, burden of disease was increasing, to understand why cutting over 200 beds from a healthcare system was not only the wrong move, it was the worst move that could have been made by the previous government. Truly damaging, because as we aptly state when we talk about investing in the healthcare system by adding beds, we always say that we're not really talking about beds, we're talking about people. That when we add beds to a healthcare system, what we're saying is we are adding folks to the front lines to provide care in appropriate settings to Manitobans where and when they need it. And so it's equally important that when we talk about the loss of hundreds of beds from the system, that we identify that that is, in fact, the loss of hundreds of frontline healthcare workers who are staffing those beds and providing care in settings Manitobans counted them to be at for years under the previous government. And so our commitment to add net new healthcare workers to the healthcare system is what allows us the ability to add beds to the healthcare system. Our commitment to adding beds in a variety of different settings is key to us being able to make sure that we have more capacity, not less. Now, that being said, as I stated already, when you cut beds from a system, when you cut people, fire people from a healthcare system, when you force folks to go down into a tunnel under HSC and jockey with their colleagues for job postings, it's real consequences. And we're seeing those consequences in the healthcare system today. It is so important that the approach that's taken to this is one that is really meaningful and sustainable, which is why our government has worked very closely with regional health authorities, with sites, to better understand their needs and to support them as they bring these beds online. As I shared just during question period today, our government has taken steps to add beds in ways that speak to the growing need, diversity of needs in terms of where people need to access services. And so standing up transitional care unit beds, I want to give a quick shout out to the Interlake Eastern Regional Health Authority, who's really been a great partner to work with, strong leadership there, really working hard to find creative solutions to the challenges that were forced upon them by the previous administration. And I had the chance to visit the new transitional care unit there, 15-bed unit that was stood up. And we didn't announce that. We shared the information after it was stood up and already operational. And it was great. It was great to tour there and meet with the staff who were so excited to have been a part of something first of its kind for them, and to meet with residents, to meet with patients who were talking about the quality, great quality care they received. I actually met a woman there, just an incredible person, who hand makes these really adorable and wonderful bears that she gives out to other patients and families. And there was one sitting on the nursing station desk on the unit. And I just thought, like, what a great culture they're creating and they're fostering there. A culture in healthcare that we want to see everywhere, of collaboration, of partnership, of empowering patients, making folks feel seen, and ensuring that when we make announcements and investments into beds, that we're able to staff them in a way that is, again, sustainable and really meets the unique needs of the folks who need them. And so I think it's important to acknowledge the good work that folks are doing. These beds don't come online easily. It takes a tremendous amount of effort. And I want to thank all the leaders in the healthcare system who've been working really hard with their frontline team members to get this done. And I want to thank our department as well. Our folks here in the Department of Health have worked really hard to identify the opportunities in this regard and continue to assess the situation as it unfolds. And like I said, 68 transitional care unit beds. I shared that in question period today. And that's just one of the many steps we're taking in terms of adding bed capacity to the healthcare system.
The Honourable Member for Roblin.
I wasn't clear from that answer. Are all of these beds open and operational now?
Honourable Minister.
Thank you, Chair. Something that I think is really important to highlight is the impacts of what it means when you bring beds online and how that works in conjunction with other investments like 7-day week discharge capacity. So, you know, we're hearing from different folks the impacts of that investment, right? 7-day week ability to discharge folks previously in the healthcare system. And we heard this really early on in the listening tour, this thing called the weekend effect. Heard this from folks where because you couldn't discharge anybody from a hospital because your staffing resources to do that dropped off Thursday, Friday, there's this weekend effect where folks didn't get, physiotherapy, social work access on the weekend. Therefore, you'd have this peak in the middle of the week where you could discharge and it just drops off. So early on in our administration, we made the investment to add 7-day-a-week discharge capacity. And very recently, there was feedback that was provided in terms of the benefits of that, you've got physiotherapy available at a hospital on a weekend, whereas previously they weren't there, and social work. And I can share that I was at Victoria General Hospital on a weekend not that long ago on a Saturday, and was in a hallway on a unit and said hi to one of the folks who were working. And she introduced herself and kind of carried on. And then she paused and she actually looked at me and said, "Oh, and thank you." And I said, "What for?" And she said, "Oh, I'm working today because of the investment into a 7-day-a-week." So this social worker there on a Saturday morning, we both recognized in that moment, oh yeah, before that investment was made, she wouldn't have been there working on the weekend, providing care to Manitobans who need it so that they can get home to their loved ones more quickly and recover at home, or, get access to the resources they need in community. And so, it's not, again, just about adding beds, it's about adding people in ways that staff those beds and provide direct care that benefits Manitobans. And so, there are steps that we're taking as a government that allow for discharges to improve the flow through the system. So, we know that as a result of our 7-day-a-week discharge investment, that discharges on the weekend are actually improving. And again, when you cut healthcare for 7.5 years and you fire people and you mistreat them, you don't see improvements right away overnight, but we're moving in a better direction. And that's what matters. Like, we're seeing these positive steps being taken. We're seeing discharge percentages on the weekend go up. 10% on a Sunday in one location makes a big difference, right? Those are folks who would have been in hospital without access to social work, physiotherapy. Maybe their care isn't moving as quickly as it can in terms of their recovery because of a lack of access. We're making those investments to turn the tide in that regard. We're seeing discharges really improve on Mondays and Tuesdays. Again, we heard about that weekend effect from frontline healthcare workers who were like, this is obvious. Every other jurisdiction is doing this but Manitoba. What's up? And so we made the investment. And now we're seeing discharges improve on Mondays and Tuesdays, which means a lot to folks. It means so much to people who are in hospital, wanting to get home to their loved ones, wanting to sleep in their own beds. And they're able to do that increasingly so because of the understanding that a bed is not just a bed. It's about how you staff it. It's how you work together and collaborate to make sure folks have access to quality care. And so, when I talk about adding 68 transitional care unit beds to the system, and a good number of those beds are already online, and the members asked understandably about where we're at in terms of the beds that we've announced previously, and we're chugging along, we're well on our way, adding these beds to the system. It's exciting not just because, as I said before, we're talking about beds, but we're talking about a diversity of frontline healthcare professionals who are staffing those beds and providing real care to Manitobans. Has real impacts for Manitobans. So the total number around, how many of those beds have come online and where we're at in that regard, I'd be happy to get that number at those particular details to the member at a later time. But what I can say is that we are focused on not only restoring the hundreds of beds that were cut by the previous government, we're looking beyond that. We're looking about not just filling up the hole that they dug. We're talking about building up in the healthcare system in a way that has positive impacts for folks for many years to come.
The Honourable Member for Roblin.
Thank you. And just as a favor to our clerks, so I'm sure they'll be wanting clarification, is the minister taking this under advisement?
The Honourable Minister.
Thank you, Chair. To be more specific, I'd be happy to take that under advisement and provide more clarity on that information for the member at a later date. And I do want to share, and I made a point of thanking the Interlake Eastern Regional Health Authority, but I do think it's important to also thank board chairs and leaders, CMOs, CEOs, folks across the healthcare system, across all regional health authorities who've been working really hard with in order to do this work. No regional health authority is the same, and no site is the same. These folks have very unique needs, and it's been really a privilege to get to meet with folks and to work with them to understand their unique needs. Everyone is facing, and we know this, it's a national challenge, it's an international challenge. The competition, use that word in a lighthearted way, but it's very real. The competition for talent, for healthcare talent, is serious. We see other jurisdictions undertaking really interesting approaches in order to recruit and to retain. It is a conversation that's happening at the national level in really important ways. But I have to say, it's a conversation that Manitoba only really just started participating in meaningfully. The previous government just really was taking sort of the opposite approach that other jurisdictions were. While other jurisdictions were getting really creative about the ways that they would solve their healthcare human resource challenges, here in Manitoba, the previous government was, saying, throwing up the peace sign to healthcare workers and saying, see you later. Closing units, making decisions that saw us lose a tremendous amount of expertise. Having worked on the front lines of healthcare myself and having most of my family, quite frankly, work in healthcare, I have a different, unique appreciation for what it means to be a nurse or a healthcare worker who specializes in a particular area. I've had the benefit of having another nurse in our caucus. The MLA for Tuxedo is not only just an outstanding person and already an outstanding MLA, she is a really outstanding nurse and has taught me a lot about what her experiences were on the front lines. She literally just basically yesterday came from the front lines into government and is doing a great job and is a direct connection for nurses and healthcare workers to have their voices heard. And, it's been really wonderful to have her expertise at the table to help inform our approach, and her relationships in the healthcare system. It's been really useful, and it's wonderful to have another perspective on the team. Our entire team is on board with making healthcare stronger for Manitobans, but it's great to have another nurse in caucus who can speak to the nuances of the healthcare system that we need to be paying attention to as a government. And, it's so important that leaders in the healthcare system can see that not only are we, undertaking a listening tour, it's a permanent listening tour as far as I'm concerned. We're going to be listening for the duration of our mandate to Manitobans and healthcare workers on the front lines. Not only do they have a government that's committed to doing the work of addressing the culture in healthcare and making meaningful investments in adding beds, but they have a government that is attracting healthcare workers in many different ways to get involved with making healthcare stronger. And I can't thank the healthcare workers, healthcare leaders, folks across the system enough for being willing, despite 7.5 years of being mistreated, being not only willing but eager to work with our government to bring solutions forward and bring forward concerns and ideas and criticisms and big hopes and big dreams and all of that, because hearing all of that is how we actually meaningfully engage together and move healthcare in the right direction. So, as I said, it's not something that we can repair overnight. It's not something that we communicate to Manitobans can be fixed in a day, or that there's one size fits all to how we do this. But it is something that we believe if we commit ourselves to building those relationships and taking steps in the right direction every day, we're going to continue to see more beds come online. We're going to see more diverse staff being hired. We're going to see 7-day-a-week discharge continue to have a benefit. And we're going to hopefully continue to see folks really engage with us because they believe in this precious and sacred responsibility that we have to make healthcare as good as it can be for Manitobans. And so I can't thank folks enough across the system for their generosity and their partnership, and we're going to keep working with all of them to add more beds, more resources, more services to our healthcare system for Manitobans.
The honorable member for Roblin.
Thank you. I want to move on to some capital questions. So one of the actions that the NDP government took when they took office was to pause or to freeze a number of projects that were underway, including freezing specialized equipment funding. And I'm concerned in particular for the catheterization labs at St. Boniface. As the minister will know, these are critical for the work that they do at St. Boniface, the life-saving cardiac work that is done there. And I'm wondering if the minister can tell the committee what the expected lifespan is of the existing cath labs and what the plan is to replace them.
The honorable minister.
Thank you, Chair. I thank the member for that question. You know, cardiac health, heart health in Manitoba is a really important priority. It is something that really hits close to home for me personally, and I know really hits home for many, many, many Manitobans, particularly women's heart health. I'm sure the member is well aware. I might have actually, I'm not even sure if we were at a similar event or the same event together recently about women's heart health. I can't recall if the member was there. I think she was, but it's so important that when we're talking about heart health in Manitoba, as we're talking about any issue really, that we identify the folks in the groups that perhaps do not have the level of access to information that they should, the ways in which we can close the gaps in terms of improving heart health outcomes for Manitobans. And, for quite some time here in Manitoba, the cardiac care at St. Boniface, it was a cardiac center of excellence, cardiac care center of excellence. I heard this a few years ago, questions from cardiac specialists in the province who were very concerned about the fact that this program that had this really important distinction nationally, really a beacon of what can be done when experts are supported, was being eroded by the previous government. I wondered if there was something I just wasn't putting together because they were so concerned and they were adamant that the previous government was systemically dismantling that program. And I thought, no way, like, why would you dismantle, erode a cardiac center of excellence, something that we shine so brightly at doing in Manitoba? And yet it was true. It was true. That's exactly what was happening. And now, we've been working with local advocates and folks to understand how do we make sure that Manitoba is a center of excellence for cardiac care. St. Boniface Hospital is a cardiac care center of excellence. It's been wonderful to meet with leadership there. These folks do jaw-dropping work in getting communities engaged to improve access to information and education and awareness. They go so far as to educate thousands of students annually. This is the St. Boniface Foundation does this work in conjunction with the hospital and post-secondary institution, the University of Manitoba. They actually go out and reach thousands of kids and engage them in cardiac sciences and get them interested in pursuing that as a path. And of course, these kids go home and they have these conversations with their families and they share what they're learning. And just by way of increasing those conversations in the household, you're supporting improved outcomes for Manitobans. It is really a testament to the creativity and the generosity of the experts we have in the province that this work is being done. Thrilled to be able to work with these folks and support their efforts to restore and go beyond that and really ensure that cardiac care at St. Boniface and in Manitoba is excellent. And, folks like Dr. Soni is a good example, just an outstanding researcher, somebody who is now permanently in Manitoba doing this incredibly important work. Thrilled to be able to support Dr. Soni and her colleagues in their efforts to improve women's heart health outcomes. It is a particular area of research that has been maybe not treated with the same level of investment or care due to systemic reasons. Quite frankly, women's health issues have not been invested in the same way. Research hasn't been treated with the same level of interest as it should have been. And it's incredible that we've got the top minds and talents right here in Manitoba who are dedicated to not only doing this work, but creating future generations of healthcare providers and professionals who will lead the way. Very exciting work being done in the province that we're happy to support. It's also important that we listen to those with lived experiences. So I want to give a shout out to Jackie Ratz as somebody who spoke at the event and shared her personal story. Again, I have folks in my own life who are navigating cardiac health issues, heart health challenges that are very real. And that quite frankly, I am relieved that they're here in Manitoba, knowing that there's experts like we have on the front lines providing this care. And it's so important to us that we're investing in making that care stronger. The member used the word freeze earlier. I'm not sure where that came from. I know winter is coming, but so maybe that's why that language was used. But we are making sure that we're working with our partners to invest in this area of healthcare. And I can provide, I'm running out of time, but I can provide more information on that front for the member if she would like.
The Honourable Member for Roblin.
Yes, thank you. I was at the same event the minister is referring to. But just to restate the question, I'm looking for the plan to replace or refurbish or whatever's going to be done to renew the cath labs at St. B. and wondering what the expected lifespan is of the existing labs.
The Honorable Minister.
Thank you, Chair. I think as the member can probably appreciate, that's actually a pretty technical question. It's a very nuanced question. And as the member stated previously, I do not have all answers for everything, although I would love to in life at my fingertips. And you know, it's a question that's really technical and nuanced, and I do want to make sure that I'm understanding, because what I would like to take away, and I think what makes sense is maybe to talk a bit about maybe generally at what point certain things are replaced. There's no standardized, you know, all the equipment would be replaced at the same time or anything like that. It's actually a pretty technical question. And, you know, obviously, as we all well know, equipment in any space for anything can, you know, maybe go longer than what we think or be required to be changed earlier than what we think, right? There's all kinds of reasons why equipment may need to be replaced or changed or upgraded or what have you. And in terms of these labs, there's going to be variation there as well that we're going to have to dig into, and we wouldn't necessarily have it. That would be something that the Regional Health Authority would have the details around and be responsible for managing and working with partners throughout the system, St. Boniface, to understand their needs, and that's really their direct relationship. That's something that we expect them to manage. You know, I can say that technology in this space is ever evolving. It's incredible to see how cardiac sciences have rapidly evolved in recent years. I'm personally excited by AI and simultaneously terrified by AI. I think like a lot of folks, you watch one too many movies and maybe your mind goes places, but ultimately I'm more excited about the benefits of AI and the rapidly evolving technology in that space. It's really exciting stuff. I had some young folks recently talk to me about AI as a diagnostic pathway forward. So how do we use AI to more accurately, more rapidly diagnose illnesses? How do we get that in the space of diagnostics? It's a really, really, again, rapidly evolving, but very exciting space. And something that, you know, maybe even 10 years ago, we would have thought to ourselves, not in our lifetime, you know, that's probably another generation that's going to be leaning into some of that. And we're seeing, you know, almost overnight, it feels like it's a space that it's happening right now. And so when we talk about the life of equipment and technology, we're also talking about what does the future of this space look like in Manitoba? You know, where are we looking in terms of best practices? What is the science and the evidence telling us about, you know, what's emerging and what we should be paying attention to? You know, we've got some really, really bright, brilliant folks in the department, data scientists who have really cool ways of applying their expertise in terms of how we can improve healthcare. And certainly there are all kinds of proponents out there that are bringing forward their ideas as well. And so whether it's cardiac care or other aspects of healthcare where we know that equipment does have a lifespan, you know, as we look to the future, we're having conversations about how do we take an approach that is meeting the needs, the future needs of Manitobans and the future evolving technological needs in healthcare. It's a really, really exciting opportunity. I've had these conversations as well with Minister Moses in economic development because it's a space that he is the minister responsible for economic development that he's learning about as well. You know, and our government does take a really an all-of-government approach to healthcare. And so when we're having conversations about, you know, technologies, it's also the Minister for Post-Secondary Education, Advanced Education and Training. You know, what are students learning on? What equipment are they being trained on? Are they being trained on equipment? We had the opportunity to go to UCN recently. What I thought a simulation lab was not what it was. It was so cool. The technology there, the way folks are learning was, again, very, very exciting. And it's wonderful to see that across our departments, everybody's in this space of how do we make sure that not only we're addressing the immediate equipment needs in healthcare and in cath labs and other places, but what are we doing to think about down the road? And so it's an exciting space. This is definitely something I've got to take away and get back to the member on in terms of the questions she's asking, because it is pretty technical and it's something that we're going to have to go to the Regional Health Authority and ask them for clarity on, and we can bring that back to the member at a later date.
Before recognizing the next member, I'd like to remind all members to please refer to other members by portfolio or constituency only. So now I'd like to acknowledge the honourable member for Roblin.
Thank you. And I thank the minister for that commitment to provide that information. Continuing on capital for a moment, in 2023, the previous government had committed to an expansion and redevelopment of the PAW Clinic, and funding was allocated and approved for that project. I understand the planning and design work began in 2023, and construction was expected to begin in this fiscal year. And I would just like to ask about the status of that project, if it's continuing and going ahead, or if it's not continuing, and what the reasons for that might be.
The honourable minister.
I'm just going to get a couple of additional pieces of information. What I do want to talk about what the member raised, you know, commitments or announcements that were made by the previous government, because I think it's important. I've learned a lot about process, budgeting process, estimates process. We've developed processes to make the processes stronger and better as a government. And I have to say it's been fascinating in this role and really, actually, quite frankly, disheartening to see what happens when a government, the previous government, takes an approach to make announcements, commitments, communicate things to folks without actually having a legitimate plan in place to execute that. We've seen it in many different ways across many different departments, but certainly in health, you know, it's tough. It's tough to sit down with different community members, organizations, healthcare providers who come to you and say, previous government made an announcement. Previous government made a commitment when they were doing whatever they thought they needed to do to get reelected. And so we're here to talk about that. And it's tough to be in a position to say, here, listen, gonna be direct and say that the processes that a government would need to undergo and undertake to execute any sort of commitment weren't done, just didn't happen. It's in the totality of the approach in the previous election, what was going on last summer in July when those announcements and that announcement and others were made. You know, when you look at, when you step away and you look at all of the the harm that was done by these announcements that weren't rooted in planning, weren't part of any actual capital expenditure plan, and attach that to a whole host of other decisions that were made in that campaign that were very harmful. It's difficult to align how that approach could have possibly been taken, knowing that the planning wasn't done in a real way. And so what we have done as a government is had those conversations with Manitobans, with organizations, with service providers, with proponents to say, listen, we're making announcements and commitments that we're going to follow through on. And it's going to require a ton of planning, an incredible amount of work, and partnership to do it. But that's what you need to do to get it done. And it's an approach that, we said from very, very early on, as a government, we want to repair trust that was broken. We want to rebuild relationships. We want to meaningfully engage, collaborate, and partner to get things done. And we're seeing the benefits of that approach. Again, nothing gets resolved or fixed overnight, but we're committed to taking that approach as we move forward. And when we talk about healthcare services in the north, our government's made specific announcements in terms of how we build capacity there, how we improve care. Had the opportunity to go to the north and meet directly with folks. And, I've met with the mayor of the PAW, and we've met with community members, and we've talked about how we work together to actually legitimately have plans that can be achieved and advance healthcare in the right direction for those Manitobans. Primary care, I'm going to go back to that because we've done work with them to ensure that we can enhance and expand team-based care, My Health Team services to the PAW, and taking tangible steps, real steps, attached to real people to improve real outcomes for Manitobans. And I do think it's important to acknowledge that there are commitments that were made that weren't rooted in any actual planning or ability designed to execute, which is concerning. But our government is focused on working with our partners now and keeping those lines of communication open so that we can chart a path forward that moves healthcare in a better direction in the north. And it's going to take time. We have made some progress, not enough, quite frankly, but we're committed to doing more and more work with our partners to continue to move in the right direction. And again, it's going to take us years to repair that damage, but we're committed to doing that alongside our partners.
The honourable member for Roblin.
Thank you. I want to challenge some of the minister's assertions there. I mentioned the PAW specifically because funding for that project was allocated and it was approved, and the planning and design work had begun. I take it from the minister's response, and I'm sure they will correct me if I'm mischaracterizing their answer, that expansion and renovation project is not going ahead. And if that is the case, I'm just wondering why.
The Honourable Minister.
I thank the member for that question, and so I'll be very clear. The previous government did not have a plan to execute the development of that clinic. They didn't. They didn't have a plan. Millions upon millions of dollars that they announced attached to that, they didn't have a plan to execute it. You know, and I know that's a tough, pill to swallow. It's not easy to hear that. It's not easy to deliver that news to communities, but they did not have a plan. And sadly, it's not the first item that was brought to my attention that the previous government announced and did not have an actual plan to execute to see that vision come to fruition. The member, based on how she's framing the questions, I think is probably well aware of what is actually required to execute a proper capital plan. And I suspect maybe she is aware that there was no long-term plan to execute that whatsoever by the previous government, which is disappointing. It speaks to other conversations I've had. I mean, we're talking other conversations where the previous government committed massive amounts of money to initiatives, went out to communities and said, we're going to allocate, over $100 million to initiatives that they did not bother, they didn't budget for it. It didn't exist in reality. An incredibly irresponsible approach. And now we're having conversations with communities, with providers, with entities, and saying, moving forward means that we actually have to have a plan. And it's been really, really positive to meet with leadership, community leadership, mayors, to have those conversations and to agree to work together to move forward in a way that does strengthen healthcare. It is really something else to understand a process in the way that we understand it as a government now, the way that I understand it as a minister, and to recognize sort of how strategic the previous government was at not being forthcoming with folks in terms of why the commitments they were making could not actually, or they didn't plan for them to be executed. Because it's once you understand the process and the details of the process and what is required for execution of a plan long-term and how you take all of those steps, yeah, it really is, it is quite something to understand what it meant for the previous government to go out to communities and commit, again, in some cases, millions upon millions, over $100 million, and never having a plan in place to bring that to fruition, really. Our government is taking an approach that is about partnering. It's about understanding the unique needs of communities. It's about building the capacity in our healthcare system to execute. And so, standing up capital infrastructure, adding beds, things like that, all of that is for none if you don't have staff, right? If you don't have people, which is part of the reason why we've set such ambitious targets, because in addition to the previous government going out and making announcements with no actual plan to meaningfully achieve them, they were actually doing the opposite of adding more folks to the healthcare system. They were cutting folks from the healthcare system. So you've got, on the one hand, making these announcements to the tune of hundreds of millions of dollars that couldn't be executed, didn't have a proper plan. On the other hand, you have a government that's not only not hiring the healthcare workers needed to staff the capital infrastructure they're saying they're going to build, they're actually cutting and closing and firing and saying goodbye to the very folks you would need to staff those projects. So, it's tough. You can't really make that make sense when you really sit and you look at it, what was going on for 7.5 years and what was going on during this sort of frenetic time leading up to an election where they realized that perhaps the approach they'd been taking was really harmful and folks weren't in support of it, weren't into it anymore. And they'd have to pivot away from what their previous approach had been. Now, obviously, Manitobans told them very clearly it was too late, long overdue, that they started talking about healthcare in a way that was, talking about building capacity, not cutting it. And so fundamentally, we're taking a different approach, which is to staff the healthcare system, net new healthcare workers, so that the infrastructure and the capital projects that are executed, that are planned for, can actually successfully be operated, because you need people. You need people when you're talking about standing up any capital infrastructure, operating any equipment, And we're going to continue to deliver on net new healthcare workers for Manitobans so that that can happen.
The honourable member for Roblin.
One of the questions I've asked fairly frequently since becoming the health critic surrounds RFSAs, or the agreements that were signed with both private and public providers to provide services to Manitobans. I've asked about this in question period. I've asked for information through FIPA. I've asked in a written question. I've asked in estimates in the spring. And I've been frustrated because I haven't been able to get a lot in the way of clear answers. And this feels like a very simple question to answer. I'm going to start with a really specific question. Has an agreement been signed with Western Surgery Center? For which procedures and how many procedures?
The Honourable Minister.
You were just waiting on some information, but what I'd like to do just provide a little bit of information on the record in regards to surgeries in Manitoba and our approach. First, I want to thank all the folks in the system, all of our partners who have been really key and instrumental to us building more capacity in Manitoba. It's been really great to work with experts in our own province who understand the value and are very keen to make sure that we have more capacity in our province, not less, and that we are investing in strengthening access to care in our province. And, it's the relationships with these folks, including with Western, that we've been able to deliver record numbers of surgeries and procedures and things like that. Recognizing that, again, the population is aging, complexity of care, burden of disease, all of these things in Manitoba are sort of unique based on our demographics and geographical reality and things like that. And we're doing the work of making sure that we're taking a provincial approach, which is an approach that's more recent for our province. And it's an approach that really takes time to flesh out and to build strong infrastructure around. So I want to thank our partners across the healthcare system who are working with us on that front, including folks at Western who have been really receptive and good to work with, quite frankly, in terms of understanding the opportunities in the healthcare system to improve capacity. Certainly, Manitobans need to ensure they've made it clear to us and to me that they want to know that they can get the care that they need in their own province. And there are proponents in our province who have reached out and we're working with in order to do just that. And, we're going to continue to build those relationships. I meet with folks pretty regularly, even, seeing people out and about in events who have really bold ideas for what healthcare can look like in the province. Post-secondary institutions, great ideas around what we can do to build capacity in Manitoba. All kinds of proponents, be it doctors or entrepreneurs and folks who have really great ideas. And so it's been wonderful to meet with them and to understand this space better. And, again, as technologies evolve and things like that, it's going to be those partnerships and those conversations that really help us make those informed investments. And I'm hoping in the next minute or so I'll have a bit more information for the member, but I do want to say that, Western and other folks have been really good partners to work with in terms of looking at ways that we can invest in having more capacity in the province, not less. And it's been great to also work with folks who understand the value and the importance of strengthening the public system. Obviously, universal health care that is protected by the Canada Health Act is of Canadian value. It's a fundamental Canadian principle and value that needs to be upheld and protected. And we see where that is eroded in other jurisdictions, families with very limited means, having to pay for very basic primary care, things like that. We don't want to see happen to families in Manitoba. And it's been wonderful that really no matter who you talk to, folks agree that universal health care needs to be protected. I've had the opportunity to be in other jurisdictions, other countries, and see the impacts of folks who don't have access to universal health care and those protections that it affords. And my gosh, it's painful. It's painful to see the impacts of that. And it's painful to know how that affects families. And it really kind of grounds you. It's grounded me, certainly as a Canadian, someone who's very proudly Canadian, to know that we have a system here that prioritizes you being able to access health care, no matter how much money's in your bank account, right? And that's an approach that we value and will continue to support, but work with our private partners and other folks as well as we develop strategies that make sure that more Manitobans get access to that kind of care.
The Honourable Member for Roblin.
Thank you. And I think that, I would certainly appreciate, and I think Manitobans would appreciate some more clarity and transparency from this government with regard to agreements or contracts that have been signed, with which providers, for what procedures, and for how many procedures. I think it's worth noting that back in the spring, the minister did commit to making that information available publicly, and it hasn't yet been made available. So I don't want to create the impression that I have run out of questions. I have never, ever run out of questions, and I have plenty more, but I am ready to close this section of estimates.
So seeing no further questions at the moment, we will now move to resolutions. Resolution 21.2, resolved that there be granted to His Majesty a sum not exceeding $13,244,000 for health, seniors and long-term care, health, policy and planning for the fiscal year ending March 31, 2025. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.3, resolved that there be granted to His Majesty a sum not exceeding $14,579,000 for health, seniors and long-term care insurance for the fiscal year ending March 31, 2025. Shall the resolution pass? Pass. The resolution is accordingly passed. Resolution 21.4, resolved that there be granted to His Majesty a sum not exceeding $32,750,000 for health, seniors and long-term care, public health for the fiscal year ending March 31, 2025. Shall the resolution pass? Pass. The resolution is accordingly passed. Resolution 21.5, resolved that there be granted to His Majesty a sum not exceeding $11,528,000 for health, seniors and long-term care, performance and oversight for the fiscal year ending March 31, 2025. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.6, resolved that there be granted to His Majesty a sum not exceeding $39,104,000 for health, seniors and long-term care for the fiscal year ending March 31, 2025. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.7, resolved that there be granted to His Majesty a sum not exceeding $788,000 for health, seniors and long-term care, corporate strategy and administration for the fiscal year ending March 31, 2025. Shall the resolution pass? Pass. The resolution is accordingly passed. Resolution 21.8, resolved that there be granted to His Majesty a sum not exceeding $4,772,003,000 for health, seniors, and long-term care funding to health authorities for the fiscal year ending March 31, 2025. Shall the resolution pass? Pass. The resolution is accordingly passed. Resolution 21.9, resolved that there be granted to His Majesty a sum not exceeding $306,014,000 for health, seniors, and long-term care, provincial health services for the fiscal year ending March 31, 2025. Shall the resolution pass? Pass. The resolution is accordingly passed. Resolution 21.10, resolved that there be granted to His Majesty a sum not exceeding $1,846,159,000 for health, seniors, and long-term care medical for the fiscal year ending March 31, 2025. Shall the resolution pass? Pass. The resolution is accordingly passed. Resolution 21.11, resolved that there be granted to His Majesty a sum not exceeding $459,000 $50,099,000 for health, seniors, and long-term care, pharmacare, for the fiscal year ending March 31, 2025. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 21.12, resolved that there be granted to His Majesty a sum not exceeding $207,890,000 for health, seniors, and long-term care costs related to capital assets of other reporting entities for the fiscal year ending March 31, 2025. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 21.14, resolved that there be granted to His Majesty a sum not exceeding $524,954,000 for health, seniors, and long-term care, other reporting entities' capital investment for the fiscal year ending March 31, 2025. Shall the resolution pass?
Pass.
The resolution is accordingly passed. The last item to be considered for the estimates of this department is item 21.1A, the minister's salary, contained in resolution 21.1. At this point, we respectfully request that the minister's staff leave the table for the consideration of the last item. You can leave your belongings, just you physically have to go. Okay.
Thanks, folks.
Thank you.
Thanks, Scott.
The floor is open for questions. The honorable member for Roblin.
Thank you, Chair. And I think this is where often, and I know this is something that the NDP did when they were in opposition, the critic will make a motion to reduce the minister's salary. I won't be doing that today. That's not my particular style, but I do not want that to be taken as a vote of confidence in the NDP government or this health minister. I hope that the minister takes very seriously the trust that has been placed in them in accepting this salary and the responsibility that they have for fulfilling a great many commitments that they made. I don't really have a question. I just wanted to make that comment. Thank you.
Are there any other questions before we proceed? Seeing none, I'll put the question on the floor. On the resolution. Resolution 21.1, resolved that there be granted to His Majesty a sum not exceeding $7,226,000 for health, seniors, and long-term care finance for the fiscal year ending March 31, 2025. Shall the resolution pass?
Pass.
The resolution is accordingly passed. This completes the estimates of the Department of Health, Seniors, and Long-Term Care. The next set of estimates to be considered by this section of the Committee of Supply is for the Department of Justice. The hour being 4:58. What is the will of the committee?
Call it 5.
Committee rise.